Thanks once again for having me. Um, as you rightfully pointed out, the name is Kenneth Freeman, a Nigerian trained optometrist currently practicing in the Republic of Ireland. Um, Following qualification in Nigeria, so far I have worked in four different countries, um, and also worked briefly as a research optometrist in one other country. That makes it five. So that would be Nigeria, Saudi Arabia, Kuwait, Ireland, and Singapore. So those would be the five countries.
Okay, awesome. So, before we dive into the challenges you faced while working in those countries, I want you to share with us your experience, your career experience in Nigeria before you moved out of Nigeria to work in those countries. How was your experience in Nigeria before you left?
Of the truth, I've not really been I've not really well yeah I did work in Nigeria briefly, say for 2 months.
How many
For
for how
two
many
months.
years?
2 months.
For 2 months. Wow, that's
I
good.
worked in,
Okay,
I worked in
right.
Nigeria for 2 months. So at the
For
time,
2 months.
after NYSC, right? After
Okay.
NYSC, I had I had a job offer. Okay, I don't know if it's right to say this at this stage, so I don't get to repeat myself again. I don't know your questions, but so of course, I finished from APSU, and then back in the days, everybody was looking to go to the north because of money. So I was one of the fellas who somehow worked my NYSC to the north. So I served in Gombe State, and then after Gombe State, I had an offer coming from Saudi Arabia at the time, and I had the Governor's State Award because I had the Governor's State Award for in NYSC. That was Governor Dan Kwambo. So they gave me automatic employment in Gombe State Specialist Hospital. Um, and then I had this other offer from Saudi Arabia. So what I did was I took while waiting for the Gombe State's government's offer, I went to Lagos, worked in a private practice for 2 months, and my Saudi visa came out, and I jackpot.
Okay, so you said 2 months, but you did your NYSC, right?
Yeah, I did, of course, I did my NYC in Nigeria, but I'm
So,
saying when you say practicing in Nigeria, I would consider practice after NYC. Okay, whatever
okay,
you do as an intern and as a core member optometrist wouldn't count as your well, it could count depending on how you look at it, but I mean that's what I'm saying. I'm saying from after NYC, I worked in Nigeria for 2 months and then I left.
okay, but in the main sense of it, you can say you practiced for 2 years because you did your internship and your NYSC.
In the main
No,
sense of it, internship and NYC are training.
that's
In
part
the
of your
main sense of it,
experience.
yes.
But it's a part of your experience.
But at that point, in fact, you could actually count NYC as practice experience because at that time you were already a qualified optometrist, you
Hmm.
know, but you wouldn't count NYSC. You get what I mean? And the reason I'm not counting NYSC is it's simply because I mean it's NYSC. It's not a permanent job. It's not a permanent job. You know what I mean? So yeah, yeah. I mean you could add NYSC. That's okay.
Okay.
But I would
With
say
that
two
being
months.
2 months.
I'll say 2 months instead
Okay,
of a year
fine.
and 2 months.
All right, it's fine.
Yeah.
So, but since you just spent 2 months before moving out, I don't know if I can ask you what were your
Hmm.
reason why you moved from outside Nigeria to go and practice in a foreign land, because you did not have enough experience in Nigeria optometry practice before you
Hmm.
moved out. So can I still ask you what were your reason why you moved and you decided not to continue your practice in Nigeria and to go and work outside the country?
Hmm.
Your
Okay.
major reason.
If I have to be honest, like very honest about it, I would say it's the money. You know, I would say it's the money, and that's the truth. Because I mean, so the truth is, even as an optometry student, if most of my classmates would have, they would remember that, you know, well, maybe they never knew, but I always wanted to practice outside Nigeria. I didn't have plans of remaining in Nigeria after graduation, so I suppose it sort of aligned at the end of the day. The motivation was, you know, money, right? Just go to a better country, get some little cheese, support family, and yeah, that was the motivation. And that was what informed the decision of Saudi Arabia. At the time, Saudi was paying great, yeah, great when compared to what we were getting in Nigeria. So the motivation, to be honest, was money. There is no sugar coats in it. It was money.
So the first country you moved to outside after working in Nigeria for 2 months was Saudi Arabia.
Hmm.
Saudi Arabia.
Hmm.
Okay, so what are the regulation and standard of optometry practice over there?
So Saudi Arabia, yeah, optometry practice in Saudi is regulated by the Saudi Commission for Health Specialties, or specialties as they call them, right? And so when you talk about regulation, I suppose what you're talking about would be the practice scope, the scope of optometry practice in Saudi Arabia, right?
Mm-hmm. Yes.
Now, when we talk about the scope, we would be talking about the the content of their training, right? And then we're talking about the legislations that support optometry practice in Saudi Arabia. So, being that Saudi Arabia, optometry practice in Saudi is regulated by a commission, a multidisciplinary commission, right? Which is Saudi Commission for Health Specialties. It's in my opinion, it's kind of difficult to expand the scope of optometry practice in Saudi Arabia, and that explains the scope, which I'm trying to explain now. So I would explain it in a very pragmatic way, right? So Saudi optometrist training, as at the last time I checked, was 4 years or 5 years. I don't think it's 6 years, right? 4 years or 5 years, after which they qualify as a BSc optometrist, even though I see them writing OD optometrist. I don't want to dabble into that. But the thing that comes to mind about Saudi optometry practice while I was there is that there isn't a wide scope. There are a lot of restrictions as to, you know, the professional boundaries optometrists are supposed to be involved in. So the setting in Saudi, just like in other, you know, Middle Eastern countries, there is a retail setting and there's a hospital setting. So the retail settings will be the optician stores, right, or optical stores as they call them. And in these optical stores, even if you qualified as a Nigerian optometrist who has practiced within wider optometry scope, you can't still exercise the full scope of your training in Saudi Arabia. So what that means is that you're not going to manage anterior or posterior segment pathologies. Number one, you're basically going to do refraction. I'm trying not to say it in a condescending way. This is our profession. You know, like there isn't a wide scope of practice. There is a narrow limitation of what you can do as an optometrist in Saudi Arabia, and that is just what it is. Let me stop at that, except if I have to further expand on it as time goes on.
So
There
that means
isn't.
we are not allowed to practice the full scope of optometry
Mhm.
practice, right?
Yeah, that's correct. So, you know, it's I wouldn't want to define it as crude, right? So basically, what happens is a patient comes in, you don't take any patient history, you just start refracting. At the end of the day, you write out a prescription on a prescription sheet, hand it over to the patient, and they dispense. That's just it. You know, there is no record keeping, there is no history taking, there is no referral protocols, there's no recall protocols. There is absolutely nothing. Believe me. Now, I'm hoping it has changed over the years, but I don't see that happening. The reason is that most of these companies are owned by non optometrists or maybe Saudi optometrists who are driven by revenue and not by their love for the profession. And they have zero interest, unfortunately, they have zero interest in improving the profession, you know? So I reckon it's still the same thing. After how many years? Don't know. Maybe, yeah, maybe 8 years. I don't know. Yeah.
So my question is, if optometrists only are more into the retails and they do more of refraction,
Hmm.
and what does ophthalmology do when when the patient comes in? They just see the patient, do the normal examination, and when it comes to refraction, they now send it out to optometrists or what? Or they also do their own refraction and then they record it.
So, well, optometrists, ophthalmologists, of course, they have their own practice jurisdiction and practice scope as well. But you see, in Saudi Arabia, I remember a lot of ophthalmologists that were doing refraction. You know, you see, somehow in Saudi Arabia, remember we're using Saudi as a case study here. I realized that for pediatric cases, say 6 years, 5 years down, right? They would prefer to go to the hospitals or clinics, right, to get their eye examinations done, even if it's going to be done by an optometrist or an ophthalmologist, right? And it makes sense because the optician stores in Saudi Arabia, I don't remember them dilating any patient. I don't remember them cycling any patient. You know, there's no cycloplegic refraction. They don't even do it. Do you get me?
Okay.
So those pediatric cases will go to the the hospitals or clinics where the patients will be seen by an ophthalmologist or even an optometrist. But to answer your question, yes, there are some ophthalmologists that clearly would do refraction who, I mean, they are not doing their, well, they could do some of the, do their procedures or whatever it is, but yeah, they do refraction in Saudi. Yeah.
Okay. All right. So, were there any? Do they have any regulation body that oversees the optometry practice there and sees to improve the practice in optometry in Saudi?
Yes. Like I said before, it's the Saudi Commission for Health Specialties. And when you talk about improving the practice of optometry, you see, in my experience, I realized that if you have an organization, a multidisciplinary organization, that is an organization that regulates different professions, right? What usually happens in those organizations is that they will bring in professions from different specialists or professions. They bring in professionals from the different professions they regulate, all right? And kind of set the standard of proficiency, determine the framework criteria for the education providers, set the policy documents around CPDs and trainings, around entry to practice, whatever, right? And then they kick off. Now, whatever happens thereafter in terms of championing the growth of the optometry profession in those countries would depend on the National Optometric Association, all right? Not that commission. Do you get me? Because the commission is not there to protect you as a practitioner, and their sole interest wouldn't be optometry because they have other professions they are regulating. Do you get me? So it becomes difficult for them to champion your cause. Take, for instance, in Nigeria, the ODORBN, it's a board on their own. The ODORBN can champion the cause of optometry practice in Nigeria with the NOA as stakeholders, right? But in case of Saudi Arabia, the people, the stakeholder who should champion the expansion of the practice scope in Saudi Arabia should be the Saudi Society, Saudi Optometric Society, as they call them, right? But then the question is it their interest? It doesn't seem to be their interest, and that's the reason they are still the way they are. So to answer that question, right, it is the role of the National Optometric Body first. They are the ones to you know um, engage the government, push the legislation that would support the expansion of optometry practice in Saudi Arabia and similar countries where you have such competent authorities. Sorry, I'm chewing something. Hmm.
It's fine. Okay. Thank you for sharing that. Then I know moving abroad comes with many barriers, many difficulties and challenges. Okay. So
Hmm.
I want to know. We want to know if working in Saudi as a foreign trained optometrist came with some challenge or few challenges or opportunities compared to optometrists trained in Saudi. Okay. Is there any
Hmm.
challenge you faced or any opportunities that came with working as a foreign trained optometrist compared to the optometrists trained in Saudi?
Okay, so the first challenge is language barrier, right?
Mm.
So being Nigerian, you don't know Arabic. By the end of the day, somehow you get to learn Arabic. We all learned Arabic. I mean, what
They
we
don't
could
speak
call,
English.
sorry,
They do speak English, right?
they speak English, yes, but also bear in mind that there are Saudis that don't understand English. You know, so I remember we used to have an interpreter. Okay, so they will have a salesperson who would interpret in cases. Let's for instance, you just arrived Saudi Arabia, and of course you have to work. So they would get you an interpreter who would interpret to your patients. So the first challenge was the language barrier, right? The the second challenge is an individual challenge. Is an individual. Is what I mean by an individual challenge is that it is a challenge for yourself. It's a challenge. Well, depending on how you want to say it, and that challenge is that if you practice in Saudi Arabia, believe me, you would lose your skill as an optometrist, and that's a real challenge. An average optometrist in Nigeria who is able to maintain, his or her knowledge, her skills, and you know, um, her understanding of optometry in Nigeria will be way better than an optometrist who has been in Saudi Arabia after 2 years. The fella in Saudi Arabia, I mean, your man is gonna, you know, come out rusty, really very rusty. After 2 years, you feel empty, especially if you're not making any conscious efforts to improve yourself. Study more, go online, do CPDs, attend interactive CPD sections or sessions. Yeah, if you don't do that, you'll be lost, and that is a real challenge. But when you talk about opportunities, the opportunity I saw there is that following 2 3 years in Saudi Arabia, you probably have a little bit of the resources, financial resources to catapult yourself to another country if you so desire. You know, that's the only opportunity I see there, which is the reality and the story for any optometrist who had worked in Saudi. Hmm.
Okay. So how were you able to face the cultural and the language barrier? Since you said some at the beginning they were providing an interpreter or a translator,
Hmm.
but along the line you have to figure everything yourself. So how were you able to face this cultural and language barriers?
Dr. Mary, we had to learn.
So you
We had
learned
to.
Sadi, you learned
Wallahi,
that.
wallahi. Ana malum Arabic. I speak Arabic.
Wow,
Inta mafi
awesome.
malum. I speak Arabic. I mean, you wouldn't sell me in Arabic. I could converse in Arabic, like make sense, have a conversation in Arabic, and that was, well, I spent 5 years in all, so we had to learn the crude way, you know. We had to learn.
Okay.
We had to learn. You would come in, a patient comes in, salam alaikum, kef halik, easily sit down. The patient sits down, kef halik, how are you? Ish mushkila are you? What's the problem with your eyes? And the person talks, they be like, like, you know, another thing is that there isn't much to do, like there isn't. Trust me, the side test alone doesn't spend like you don't spend more than 5 minutes in the side test. Believe me, it's not
You don't
nice.
spend how many minutes?
You don't spend more than 5 minutes. Trust me. Believe me. It's like 3 4 minutes. You're done with the side test. It's oh Jesus. It's not nice. It's not. They are lucky in that country.
Optometrists
They're,
are lucky.
they're lucky because was an island they will sue the hell out of you. You know. They're very lucky.
I won't say they are not lucky for me. They are not.
They're lucky. See, have you ever seen a Saudi optometrist? It's as if we're dwelling on Saudi for a long time. We need to look at other countries. But the thing is, if you see a Saudi optometrist who is practicing outside Saudi Arabia, that means that optometrist did not train in Saudi. Do you get me? That's one. You know, and another truth is that most of them do go back, even if like at the time there were some Saudi optometrists who even went as far as doing PhDs abroad. Like when I mean abroad, they've gone to the US to study up to PhD level funded by the Saudi government. They still go back to Saudi to do the same thing. You know, see, if we have to drive change as optometrists in our individual locations, we really have to make effort to improve the standard of optometry practice in our different locations. I mean, what's the essence of studying up to PhD level in a place like the US, where you've seen people practice at a very high competence level, right? And then you go back home without replicating the same thing. And the truth is, nobody actually stops these practices from maintaining the required standard. If you have an eye clinic, if you have an eye clinic in Saudi, and you want to say, okay, even if you want to have walking patients, you're going to have um, a recording software in your practice where patient data will be imputed. You're going to do proper history taking, proper record keeping, have proper referral protocols and recall protocols, and have at least 25 minutes, 30 minutes site testing or eye examination time. Nothing is going to stop you from doing it. Nobody's going to come in and say, oh, you shouldn't do this. That's not the way it's done. No. But the thing is, they are just not interested in doing that. You know? I mean, it's sad. It's sad. We're talking
Okay,
about
so
Saudi Arabia here. It's not only Saudi Arabia, believe me. It's like that in the whole of Middle East. Oh Jesus, I was in Kuwait. You know, it was the same thing in Kuwait. As a matter of fact, what I did differently in Saudi Arabia was that I so I was lucky enough that I was in a practice where I could control the team at the time. So I had to tell my guys. I actually printed a patient record form, right? I printed it off. I had files for the patients, and I was actually clocking my patients as normal. Do you get me? Now, in terms of instrumentation, there wasn't much. It was just a slit lamp. I had to buy a Vogue from India, right? I had my ret as well. I remember I had to buy an eye massager just to have add something to the clinic, you know. And then we have an autoref. So basically, is you have your projector, you have a slit lamp if you're lucky. Some of those practices don't even have a slit lamp. They don't have an ophthalmoscope. Believe me, they're not doing any internal examination. Number two is they don't do no number two. Do you get me? So the patient just comes in, they put on the VA chart without even recording their entry VA. They just refract 2 minutes, 3 minutes, they are done, the right procedure. So it was tough, you know. Um, so like I said, I had to design a patient record form, do the right thing, just keep myself at that level while collecting the money. The reason we're there already. So yeah,
so
it's the same thing in the Middle
currently
East,
now,
the whole of Middle East.
currently now you're working in Ireland, right?
Hmm.
So how do you compare the practice in Ireland to the Middle East, where you practice the countries where you practice in the Middle East?
So Zimbabwe was better to start with. Let's go to Zimbabwe.
Okay.
Zimbabwe was better. The practice I was with is a top-notch practice. As a matter of fact, they had ophthalmologists who were affiliated with the practice. They did things well, you know. Um, Even though at the time I was in Zimbabwe, they had not even started their first optometry school in Harare. They were about to start at the time I was in Zimbabwe, right? So there wasn't even any optometry school. Not to add that optometry in Zimbabwe is regulated by the Pharmaceutical Council of Zimbabwe, which is a different issue altogether. So imagine optometry as a profession being regulated by Pharmaceutical Council of Zimbabwe. Okay, so let's leave that. But you know, um, the practice in um, Zimbabwe was great because the practitioners trained outside Zimbabwe, so they would have trained in the UK and South Africa, so they were able to maintain demonstrate proper standards of proficiency and practice at a significantly high level. Um, of practice, if you like. Now come down to Ireland, right? I want to explain something in this chat we're having. I actually did, sorry, I did scribble some things, right? I only wish that we have an audience that would, even if they don't listen in, by the time we have this video out there, they will be able to watch it and maybe learn one or two. So you see, there is there is what they call the global competency based model, right, of optometry practice. It's a document, um, it's a revised document by the World Council of Optometry that's sort of highlighted in details, right, or described in details the the various scopes of optometry practice, right, and the
Okay.
competencies, okay, expected of optometry practices and training in different parts of the world, you know. Now, there are four categories. Now, remember, the question you asked is how does Ireland differ from the other countries I had worked in, right? Now, um, so the categories by the WCO's document, right? They have the first category is the optical technology services, right? Now, the optical technology services are optical stores, right? They're optical stores that sell eyewears, repair frames, fit lenses, right? Basically, right? So if you go to countries where they have such services, okay, optometry practice in that country could be referred to as being at category one. Do you get me?
At being at, I did not
As
get that
being at
part.
category one,
All right.
okay, within that competency model by
Mm.
WCO, right? Now, in those optical stores, there is no optometrist, okay? So people working there could be referred to as technicians or opticians depending on their training, okay? If they have a formal training backed by a certificate or not, all right? That's that one. Now, I reckon that so many years ago, before the likes of late Professor Paul Obuehi with his associates established optometry practice in Saudi Arabia, okay? I don't know how long, many years ago, but back then, what they had, the standard of optometry in Saudi was at this level. Do you get me? Was at this category level one. Then they started training optometrists. Eventually, they started employing optometrists in those retail outlets. But the problem is that the retail outlets still assume the position of category one. Do you get me? They still assume the position of category one based on the instrumentation within those practices, right? Now let's go to category two. Category two are outlets where you actually have optometrists who perform visual function services. They carry out eye investigations and examinations. Do you get me? All right. So they are able to render optical technology services, number one. And then two, they perform visual function services, investigations, and examinations of the eye. Okay? So these are category number two. There are still countries that fall within this category. I think France is one of them, but I'm not sure. Now let's go to category three, which is practices that provide one, optical technology services, two, visual function services. They carry out investigations and examinations, and they also carry out ocular diagnostic services. In other words, they are able to perform one, two, and this three, which is ocular diagnostic services, which includes investigation, examination, and evaluation of the eye and external agnosia, as well as associated systemic factors, right, to detect any eye disease or ocular disease. That is category three. This is where Ireland falls in. This is where Nigeria falls in. This is where Ghana falls in. This is where South Africa falls in. This is where the Philippines falls in. Do you get me? This is where UK falls in. All right. Now, before we go to category four, okay, category four are practices, okay, or countries. I've been saying practices, practices, but I'm supposed to say countries. Are you getting me? They're supposed to be countries because before the practices can provide these services, there has to be country legislation that will support the provision of these services. Do you get what I mean? So they are countries, not just practices, even though at the end of the day we're talking about practices in those countries. So category number four, you have countries that optometries within or in those countries are able to perform or provide optical technology services, visual function services, ocular diagnostic services, and four, ocular therapeutic services, right? Again, Nigeria falls in here. So, based on this global um, model, okay, competency model by WCO, Nigeria should be at competence level four. Do you get me? Like Ireland, okay? That level four means they are able to use pharmaceutical agents and other procedures, right, to manage ocular conditions and diseases. Do you get me? So that is where Nigeria falls in. Okay. But I know there has been some, like, there are not like an argument, so to say, but different competent authorities have policies, which forms part of their regulatory role, which prevents optometrists trained in certain areas from getting direct recognition in optometrists trained in certain countries from getting direct recognition in their own countries. All right. So Ireland could be said to be at competence level three or four, depending on how you look at it. The only reason why Ireland is not at level four is because they are not using therapeutic agents. Do you get me? They could. We are using diagnostic agents. We're using our cyclos and we're doing our cyclopedic refraction. We're using our mydriatics to perform our examinations, but we are not prescribing when compared to the UK. Do you get me? UK prescribes. If once you qualify as an independent prescriber, you'll be able to prescribe, especially for anterior segment pathologies, right? But in Ireland, you can't prescribe. It's not nobody, no pharmacy is going to look at your prescription. Do you get me? Now, see the odd thing. Even if you qualified in the US as an OD, and even if you're you're performing laser surgeries in the US, right? Whatever the case is, if you come to Ireland, you can still perform those procedures because the legislation does not support it. You can't even prescribe. Even you, as an OD optometrist in Ireland, forget about prescribing for any kind of pathology, right? And that explains the reason you don't see any optometrists from, say, Australia, Canada, US, how many now? The big four: US, Canada, Australia, New Zealand. You don't see them practicing in the UK or Ireland. Do you get me?
Okay.
Because they come down to have restricted scope of practice. That's number one. And number two, their salaries are way bigger than what you have in UK and Ireland. You see, so why leave their comfort zone where they're going to be making more and practicing the full scope of their profession, and then resort to coming to Ireland or UK where they are further shrinked to a narrow space of practice, which ultimately will result to their losing their skills. Dr. Mary, if you were to stay away from optometry practice in the next 3 months, trust me, you'll be looking around in your clinic by the time you get it. You know. So yeah, those are real challenges. Yeah.
So my question is, if optometry in Ireland are allowed to diagnose pathologies and also what happens after that? In the case where you just
Well, you,
diagnose an allergic conjunctivitis
you
or
refer.
bacterial,
You have to refer. You have to
you
refer.
refer.
Trust me, you have to refer. And see, well, there are referral protocols for any ocular disease diagnosis. You will refer to, so you could refer to an ophthalmologist, okay, and the ophthalmologist would confirm your diagnosis and prescribe, right? Or sadly, you could refer to the GP, and your GP will write a prescription based on your diagnosis.
Seriously?
That's a
So
different conversation altogether. That is where I have a reservation
if
with.
you check, if you analyze it very well, that means it falls back to optometric practice in Saudi Arabia or the Middle East because
It's not.
them
It's
they
not
are
the
not.
same. It's not the
It's
same.
not the same.
Mm-mm. The difference is this. Yeah, the guy in Ireland and UK will have proper, will conduct proper patient examination using high-end instrumentations. All right, proper record keeping. There is proper referral protocol, proper recall protocol. Okay, they are using diagnostic agents, right, which is not applicable in Saudi Arabia. Okay, the only difference is that they are not, the legislation in Ireland does not support optometrists writing prescriptions for the management of anterior segment pathologies or even posterior segment pathologies. Do you get me? That's the difference. But they would refer, they would make diagnoses. Do you get it? They will make diagnoses and refer based on their diagnosis. All right? But they can't prescribe for as minor as allergic conjunctivitis. Because if you write the prescription, the pharmacist is not going to recognize it. And
Okay.
I'm saying this to, you know, Irish optometrists who could stumble on this video. It falls on the association, which is the Association of Optometrists AOI, Association of Optometrists, blah, 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 Association of Optometrists in Ireland, right? It falls on them to champion the cause for the expansion of optometry practice in Ireland. It doesn't fall on the regulator in Ireland. Again, the regulator in Ireland is a multidisciplinary regulator who will not just be concerned about optometry course. Okay, there are other professions they are regulating, so they won't have to spend their time trying to help optometry expand or optometries expand their scope of practice. You know, so it falls on the national optometric body to engage the government, engage the public, go through proper consultations, public consultations, consultations with the government, with other stakeholders, and see how they can improve the scope of optometry practice to the benefit of the patients we're looking after. You see, so yeah, that's where and how it is.
Okay. Thanks. Can you see